Welcome everybody to the Decode ME study webinar. We've had several webinars previously, but I'm delighted to say that today we're joined by Sian O'Leary, who's one of our patient public involvement members. Sian will be talking about the work that she's done and is involved in alongside Chris, who's going to give us some updates. But first of all, I want to just say a thank you to our colleagues. We have a huge number of people that are working as part of the Decode ME study. We have, and Claire's just sharing a slide for you at the moment. It may be that you can't see it fully, maybe, there we go. So it would take me ages to read through everybody, but I want to acknowledge that we're a huge partnership. We have people with ME at the very heart of the work that we're doing, carers, scientists, charity members. We have a number of partners that input as well. So Itinerus and Hot Tin Roof who are involved in PR and marketing. We have our Solve ME colleagues. We have people at the Bioresource Centre who are going to be processing samples. Gemini Print who are producing the spit kits and sending those out. We have our funders, we have the community who have engaged in surveys. You've given us great suggestions, you've helped us promote the study. We have social media ambassadors that are working to help us in the background. We have colleagues in Action for ME and the University of Edinburgh who are outside of the core project team that have given their time freely to make things happen. We have our scientific advisory board led by Professor Sir Stephen Holgate. We have Helen from the 25% ME group who are helping us ensure that people can be involved where they have more severe ME, and a whole raft of other people that are supporting the work that we're doing. So I just want to acknowledge everyone that's played a part and to say a huge thank you to all of you and those of you that are probably going to join the team at a later stage. So I'm now going to hand over to Chris, who is going to give us an update on the work that we've done and also outline the work that we've got ahead of us. And we'll celebrate some of the successes that we've had so far.
Thank you very much, Sonia. So as some of you know, Decode ME is seeking to recruit 25,000 people in the UK diagnosed with ME. Because some people will not fit the exact criteria that we'll use, we have to engage many thousands more. We always knew this was going to be a huge task, but exactly how huge, to me, has only really become apparent over the last year. So the first thing I want to say is sorry. There has been some impatience, which is completely understandable, about the fact that we have not yet launched. Many people have waited decades for this kind of huge study, and we don't take this project or the subject or people with ME at all lightly. So I understand this, this viewpoint. I have been trying to get this study up and off the ground for 2.5 years, and I cannot imagine how it is for people who have lived with ME for much longer. So what have we been doing? Well, you know, this is Diana, and she is the project manager, and she's working with people from you and me, in the States, Solve, Thermo Fisher for Royal Mail, for Biocenter, with people doing the, putting together the spit kits. Well, she's been making sure that there are all contracts, that we have contractual arrangements with everyone, that we have procurement, because there is different procurement law in Scotland. We have to make sure that all that procurement is done properly. And she has done all of these things in difficult circumstances because of the pandemic. Then we also have to ensure that when we share data with people, and I'll talk about whether this data is personalized, and almost always it is not. I'll talk about that in a minute. When we share data with people, again, it's under contract. So we know exactly what it is that we're sharing with people. So why we need to do this is that, for example, if a spit kit is lost, then we can find that out immediately and send one out. So more recently, we've been focusing on our computer systems here at the University of Edinburgh. And these computer systems, of course, need to be robust to being hacked, and also are set up according to GDPR regulations. And I have realized over the last few months that I seriously underestimated the amount of work required for this in-house computer system. I initially planned for something which was much smaller. It's as if I originally planned for completely new plumbing in a townhouse, pipes going in and out that don't leak, etc. But what we actually need now for Decode ME is new plumbing for a very large hotel, like a sort of busy airport hotel, much more complicated, needs a lot more thought and planning. And we also needed to take our plumbing inside, outside, to join up the Solves, you and me's infrastructure. And that was because we needed to use the QRME symptom assessment algorithm. This turned out to be far more complicated than we anticipated. Now, in response, of course, we've roped in volunteers to help with all of this and put more people on the case. But I'm sorry I got that wrong. Now, we've also got our control data. We've already got that from UK Biobank. So that's something we've already done. Now, I'm a kind of glass half full type of person, but sometimes that isn't realistic. And it's taken longer to do things than I had originally anticipated. And again, I'm very sorry for this. Added, of course, is COVID and all its impact, scarcity of cardboard, people coming down unwell, and difficulties of working from home. But everyone's working full pelt, and we're getting there. We're getting there, ensuring that people on their computers can do the questionnaire, and people who are at home who perhaps need help, and through Helen Baxter and the 25% ME group can have that help to ensure that everyone possible can contribute. And this was something that was one of our core values at the beginning, was inclusivity. And that took time, and it's taken longer than I had ever thought. But it's well worth it. It's well worth making sure that our web forms are accessible, that there is accessible language on all web pages, and PPI made sure of that. So PPI is, of course, at the heart of everything that we do. So we've needed to slow down at times to ensure that people have had their say and could contribute to decisions. And the value from that, I must say, has been enormous on many things that were not previously foreseen, including scientific value, which is interesting, isn't it? So we're going full pelt. And now we find that Christmas is on the horizon. And if we were to launch it next month in December, then people might be distracted because of Christmas. Spit kits would get lost in the post. Our media campaign would get drowned out by everything else. So we now have to think about January, once everyone's back from their well-earned holidays. So that's what's next. We will recruit our first participants in January. We will gradually open up for more and more participants after that, once we are absolutely sure that our digital processes are working efficiently. So there are dozens of people, as Sonia said, working on Decode ME, almost all working in the background. PPI, lawyers, data security experts, digital marketing, PR companies, each and every one has been working flat out on weekends, in evenings, all of them to make their contributions. They are doing this, and they want to do this because of the importance of the project to you, not just to us, but to you, to people with ME. So thank you, and thank you for your patience.
You, Chris. Sian, you're now going to talk to us about patient public involvement and tell us a little bit more about how you've been involved in the project and what difference it's made.
Yeah, so it's fantastic to be here. I'm Sian, I have ME and I've been involved in Decode Me for the past year on the patient, well, a bit over a year now, the Patient and Public Involvement Steering Group. So today I want to talk about the power of patient and public involvement, with the first question being kind of, what's the point of involving patients and carers? And it makes studies better. And I think that's been demonstrated time and again in the past, but we're now proving that to be absolutely true in Decode ME. We're succeeding here in being a gold standard in patient and public involvement. And that's amazing in terms of its impact on Decode ME, but also because it sets a high but achievable standard for future research into ME and other diseases. So I'll say a bit about how we work in Decode ME, then I'll tell you some of the specifics of what patient and public involvement has done. And finally, I want to talk about the power of that as its own success story. So firstly, how we do it. We have a management team, a patient and public involvement steering group, and then we've got 3 delivery teams: the cohort delivery team that I'm on, the marketing and communications team, and the genetics delivery team. And they work on different areas of making Decode ME happen. Every single team has patient and carer representatives on it. And I think it's important to start by saying that this isn't tokenistic. The staff working on this project don't go away, make the decisions, come back and ask us briefly, and then go off again. We, the patients and public representatives, are there developing the frameworks and making the decisions as we go along. This is so important for getting things right, as it means we're ensuring the decisions will work for people with ME from the start. Our steering group has representatives with ME, carers, and reps from various UK patient organisations. But we know that a small steering group can't fully represent the breadth of experience of ME. That's why we've brought on additional representatives into the different teams working on Decode ME. Our team is made up of people from all across the country, and we work collaboratively through things like Microsoft Teams, Zoom meetings, and more. I know multiple of our team members come to meetings from their beds, and I know I've done that too, because that's what works for us. And each team is working to make sure that they are doing what they can for their individual representatives. That might mean having 30-minute meetings instead of 1-hour-long meetings, or scheduling them for the time of day that works best for those specific individuals. And we accept and acknowledge that ME is a fluctuating illness. Things change over time, the amount of involvement we can have changes over time, and that's okay. That's part of working with people with ME. In particular, we're aware as a whole team, whole group, that people with severe ME have often been excluded from research, and that's just entirely unacceptable. I myself was severely ill for about 4 to 5 years, and if I could have taken part in research if it had been funded and made accessible to me, but it wasn't. We also have carers on our team, such as Claire, whose daughter is severely ill. And it's this sort of lived experience, past and present, that helps us constantly keep in mind how we can ensure people with severe ME are supported to participate. And it's vital for the genetic analysis we'll be doing too. We need people of all severities to take part. And without patient and public involvement, I don't believe this would be happening. Living with ME or caring for someone with ME is not a singular experience. Everyone has a different perspective. And that strength in bringing on many people instead of just a few shows through in the work that we're producing. This is particularly true for accessibility, one of the key areas that people with ME and carers are advising on. 2 people with ME may have very different access needs. And by having many people advising on this, we are creating multiple routes and access options for participants of this study to make it as open to all as possible. So let me share some of the specifics of what patient and public involvement in this study has changed. In developing the website, one person with ME raised the importance of having a dark mode, and others supported this. That's now there on the website. And together, earlier this year, we supported the redesign of the logo and colour schemes to ensure that they meet the highest accessibility standards. There's a whole load of important documents that come with a study like this, but 2 of the big ones for those participants are the participant information booklet, and I have a paper version here, but most of it will be online, but it's very exciting, and also a privacy policy. These all went through a major rewrite process earlier in the year to ensure they're written in plain English, gave all the information that was necessary, but didn't give too much information, because we don't want to ask the participants of this study to read more than they have to. We actually sent out some of these documents to a group who had registered their interest in taking part earlier this year for additional feedback, and then made further edits based on this. Part of participating will be a questionnaire, and that'll ascertain kind of what symptoms you have and other things. And we've honed that and tried to be as streamlined as possible there, making sure that every question that participants are asked is vital to the study and communicated effectively. And we've tried to take into account the energy and cognitive processing that's required for this process. We know firsthand how difficult it can be to fill in questionnaires. So we've made sure it's simple to save and return to the same place on the online version. And we're trying to do everything we can to allow people to take the time they need to pace their energy as well as they can. But we know that an online route is not accessible for everyone. And so because of our involvement, there will be a fully offline route to participate in this study too. Not everyone with ME has access to the internet. And considering over 75% of people with ME are not in work, and many of them for prolonged periods, we know that not everyone will have had access to technological advancements. And on top of that, the cost of internet access, phones, tablets, laptops can be out of reach for some people on benefits. And then there's people with severe brain fog or sensory overload symptoms who can't manage online technology. So the offline paper-based option will be there for those who need it. And we're now developing additional support with the support of 25% ME group so that people who need it can get that extra advice and input whilst they're going through the questionnaire process. Additionally, our input has enabled the spit kit process to be designed specifically with the ME community in mind. We're striving to make the process, and that includes receiving the kit, providing the saliva sample, and returning the kit as straightforward as possible and suitable for all severities and postcodes. And we're currently testing the spit kits ourselves, so we'll hopefully be getting a few in the post to our team in the next couple of weeks so that we can trial each step ourselves. I'm really excited about having something tangible to hold and test. And knowing that that's going to go out to thousands of people who want to participate in this study and who want to find out what's going on with ME. And so, yeah, I'm definitely getting a real sense that that's building excitement in the wider team too. We've got a marketing and comms team who are amazing and do a hell of a lot of work. And as patient and public representatives, we are out there living in this community and communicating with this community the whole time. And this is so helpful when it comes to deciding on what blog posts to put up and what online content and updates the community would like to see and need to see, because it's literally the community through our reps that are deciding this. And all of our online content and messages are reviewed and approved by patients and public representatives. And often, to be honest, they're written by us ourselves. So that's some of the specifics. But I also wanted to say that, yeah, I've had ME for a while now, and I've been increasingly involved in the community over the years. What is obvious to all is that there is still far from enough research happening. And on top of that, some of the research that has been funded hasn't exactly excelled in patient and public involvement. Decode ME is absolutely about genetics. And ultimately, it's about understanding the causes of this disease and hopefully getting clues on how to treat or cure it. That's what's going to make the biggest difference to those of us living with this illness. But what we're doing here through our involvement is a success story in its own right, and one that we should be shouting about. Involving people with ME and carers is not a burden, it's an absolute advantage. We now have a group of people, amazing people and researchers who can share their knowledge and expertise in this area. And people like our project manager, Diana, who has won an award for her work involving us in this study. We are setting a benchmark for future research. And this means that as we hope to see more research funded for ME, we can also demand that it lives up to the ideals that we are achieving here. I'll pass back to Sonia for the rest of the webinar.
Thank you, Sian. It's really helpful. And I think all of us are proud of what we've achieved as a partnership so far, notwithstanding the frustration that we've shared about not launching recruitment in the timescale we'd initially hoped and having to push that back. But as Andy Devereux-Cook said earlier, we had a whole group meeting, and he said this is groundbreaking. It's setting the foundations for future research. And I think, Sian, you've just outlined why that is. And our hope, our shared hope and our shared ambition is that we can learn from the delivery of this project. We can identify the strengths, but we can also identify what we do differently going forwards, because we don't want this to be the end. We're going to have leads, hopefully, that we can follow from this research, but we also need to do more. And we want to see a Decode ME Mark 2, Mark 3, so that actually we increase the numbers, we increase the statistical power, and scientifically, and I'm sure Chris will correct me if I'm wrong here, we will start to see more, and that's where the real excitement comes. So it's absolutely critical that we learn from what we're doing now. So thank you to everybody that's joined, but also to those people who are live on Facebook. I'd just like to acknowledge that our colleagues Claire and Danny are working in the background on social media, feeding through questions, making sure the technology's working. And to those of you that are in the Zoom webinar, you can type in questions through the Q&A. I've got them on my screen, so if I look slightly distracted, it's because I'm trying to find the questions on a small laptop screen, as well as look at a list of questions that I've got here as well, and things that are coming through on social media. So we're trying to answer as many questions as possible. But I just want to highlight that if you're over 16, you live in the UK, you have a diagnosis of ME, then you are potentially eligible to participate in our Decode ME study. Please, please, please sign up for updates via our website, because you will be first in line. When we open recruitment in February, then we will contact you all to let you know that we've opened before we go public, and therefore you will be first in line. So do sign up to the website www.decodeme.org.uk. There's also lots of information in the FAQ, frequently asked questions section. You can find out about all the other people that are working as part of our partnership team, and you can we'll be updating the FAQ with pictures of the spit kit. Somebody's asked what actually is a spit kit, so I'm going to hand over to Chris so that you can tell us what a spit kit is.
So we want people to donate their DNA, and what we don't want is to come and take blood, because that would be far too difficult for many and would also be expensive. Much easier to ask for your saliva. And so what we have planned is for people who are eligible for the study to receive a kit through the regular post, into which they present their saliva sample. It's only a couple of mils. It take a while, but a couple of mils into a tube. And then that can go back into the regular post, and will go to our partners in Milton Keynes, who will extract DNA from it, and lots of things happen after that. That's why we need spit, saliva, and we need tens of thousands of people to do that for us. Thank you.
And as Sian mentioned, we're at the point where we're going to be trialing the use of the spit kits. So we will have some pictures that we'll put out on social media and on the website for you to see. We've got another question from Roslyn, who says, what should I do if I've not been contacted to provide a spit sample to the study? We haven't opened recruitment yet, so nobody has been contacted or sent a spit kit at this stage. 1,000 people will participate in the first phase of the study in January, and we will pick people randomly. So we will only be inviting that 1,000 group, and that's for us to fully test the process. Then after that, a few weeks later, we'll be contacting everybody who's signed up through the website. You'll get an email and you'll be invited to participate. You'll complete the questionnaire. And if you're eligible, and not everybody who has ME will be eligible, because there are scientific requirements that we need to meet. It doesn't mean you haven't got ME, it just means that for this study, you're not able to participate. And we understand that will be upsetting and frustrating for some, but we will tell you who's participating and who's not eligible to participate and what's going to happen next. And for those that aren't eligible to participate and receive a spit kit, you can still provide details that are going to be helpful for research, and you can give consent to be contacted about other research. So we urge lots of people to participate so that that information can be collated and you can still engage in future research. Linda would like to say that she's got no question, just to say how much she appreciates the efforts being made here. No need for any apologies, especially when delay is due to painstaking attention to detail, along with the unavoidable effect and impact of the pandemic. Thank you, Linda. Got a question from Jen, which I'm going to direct to Chris. I've moved to Europe, but still have a UK address. Can I still participate?
We'd be delighted to send a SPIT kit to a UK address for you to fill if you can. So if that's possible for you from the UK address, that would be fabulous.
Thank you. We've had a question in advance, which is, do I have to travel to a clinic to take part? I think just to remind people, Chris outlined that you will be able to send your saliva kit from home. We wanted to make sure this was accessible as possible. And for those with more severe ME, and particularly very severe ME, we appreciate that not everybody will be able to give us a saliva sample. We do understand that, but we have tried to make this as inclusive as possible. And Helen from the 25% ME group is helping us by supporting people to fill in the questionnaire offline if they really can't do it online and you have nobody in your immediate support network to help you do that. We've got a question from Facebook. How are you going to ensure that those applying to take part actually have a firm diagnosis of strictly defined ME/CFS, considering that nearly 50% of those referred to the British Association for CFS-ME, or known as BACME, member NHS services, after thorough assessment, turn out to have an alternative diagnosis? Chris.
So we will ensure that people are in accordance with the Canadian consensus criteria or the IOM and AM criteria. So these are internationally well understood and well used sets of criteria. We have also exclusionary criteria, which are to essentially try and address this issue. But we do not expect to reduce the number of those who perhaps in other circumstances would be diagnosed with something else. We do not expect for those people to be reduced to zero. What we do expect is that we will have a vast proportion of people who will have ME according to the strict definitions that I mentioned, that are therefore of firm diagnosis by a healthcare professional. And that will provide us with the statistical power that we need to determine what are the genetics that distinguish people with ME as a group from others in the UK.
Thank you. And that's one of, just to highlight, that's one of the many areas where people with ME and carers have been involved. We went out and consulted with a large number of individuals to help inform our application and then the study design. And lots of the ideas that we're now building up through the marketing and comms group to help us increase the numbers of people participating have come from people in the community who responded to surveys and sent in their ideas and suggestions. So question for you, Sian. How do we monitor or record how people with ME are being involved in the study and decisions that this impacts?
Yeah, so that's a great question. And we have a whole log system. So each of our groups keeps a log of everything that the PPI representatives are commenting on and making changes on. And I think that will be really helpful to be able to look back on in the future. It's just an Excel spreadsheet, but it kind of clearly shows this decision was made and this alteration was made. And I think it's going to help future researchers and research studies as well, to maybe not even have to ask those questions in the first place, but have, a system there. And there's little things like we're using white envelopes because we know that the DWP use brown envelopes and they create a level of fear in people with ME. And there's a load of tiny things along the way that are just being changed and adapted because of our input. And yeah, I'm excited to see how that can be used in the future as well.
Thank you, Sian. And another question that we've had in advance was around what we've learned by working with people with ME, CFS and their carers. And Sian, you've given us lots of fantastic examples of that. And I think one of the things that we've learned as a management group, so that's myself, Chris and Andy, is that at times we've had to slow things down to make sure that people can be involved properly. And that's balanced against the desire to push this project forward, so that we can start recruiting as quickly as possible. And that balance is really tricky. And at times we've had to slow things down, and at other times we've sped things up. But we are still committed and still on track to deliver this study on time. So despite the fact we've pushed back the recruitment launch date, we are still planning to deliver this study on time. So along that vein, Chris, what advice would you give other researchers for improving their research by working with people with lived experience?
Well, listen, that's the first thing. Be open-minded. Be prepared to have your mind changed. Know that people with lived experience often are more expert than scientists are, who, by definition, plough their own field, right? So I think it's more and more important to recognize that what scientists should not do only is engage. What they should do is involve, which means that right from the beginning, right through to the very end, we work in partnership. And this is a co-production. And it sometimes, as you said, takes longer. But I would argue from this experience, that probably in almost all cases, it will make the science better.
Thank you, Chris. So I think we had another question around how there might be, or what wider implications for research there might be, and I think Chris has responded to that. The next question is have we asked patients and the public what other studies there should be into ME other than the genetics work this study is doing? So I'm going to pick that one up, because Action for ME was funded to deliver a priority setting partnership, and that has been set up through a partnership of people with ME, carers, ME charities and clinicians working in the field. And the purpose of that is to identify the top 10 research priorities from a clinical medical perspective. And we have gone out and asked people what priorities they have for ME. And now we have launched a second survey to say, help us prioritize the top 10. You can find out more about that through the psp-me.co.uk website. And Sian, given you're sat here, I'm going to say you've been heavily involved with that alongside a whole range of other people. So patient-public involvement is truly transforming research in ME, but it's a start and we've got a long, long way to go. Another question that we've had through the Zoom webinar is there a diagram showing where we are in the study process, and when will we know if we are participants in the study? So we've responded already to the participants in the study. You will get a notification after you've completed your questionnaire once we open recruitment. We'll take away and think about whether having a diagram is possible on the website. There are lots of ideas, and the focus has been on getting everything in place to launch recruitment, but I think it's a fantastic idea. So we will certainly add that to the list. A comment from Mark: my 30th year since diagnosis, so very much welcome the work being done to advance research. Question for Chris: how long will it take before the information is analysed, and have you any practical application?
So the DNA will be extracted quickly. The DNA will be analysed by Thermo Fisher, and that will be done in batches. That will take some months. So we should tell you that we'll get our first data back by the end of 2022. Then we will be having to make the analysis, which is tricky, and it's big data science, and that will take some months. So the first analysis in anger will be, I don't know, halfway through 2023. But what we will not do is be early in telling you what we think of as the result, because it may be wrong. We have to be firm in our scientific opinion as to what the results are before we come forward and tell everyone. But we will do that ahead of publishing in a scientific journal. There was a question at the end I've missed.
It was about the application of findings. And actually, I'm going to link in another question with that, Chris, from Natalie, who says, will this study try and find a diagnostic test that definitely tells a person whether they have ME/CFS? So maybe you could just sort of give a sort of broader answer with that.
I think it's unlikely that this study is going to give a diagnostic test. And I'm sorry about that. But what it will do is say, we hope anyway, that it will say what is going wrong in people with ME, what's causing your symptoms, and that will then shine a light on what aspects need to be studied next. So I think it's true to say we don't know what's going wrong. There are plenty of hypotheses, but how to rank those hypotheses as the most likely to be true, that's what genetics does. So once we've ranked those to say, the top 3 are, I don't know, mitochondria in particular neurons at a particular time in your life course, then we can do the experiments. But it will also deprioritize and may say that other aspects are not supported by the evidence. And then we should, I would hope that my fellow scientists will stop working in those areas and reprioritize their work towards other areas that have greater evidence for it. That will then take time for others in pharmaceutical industry, etc., to pick up on those discoveries and run with them with new drug targets. If we're lucky as a field, then we can take drugs that have already been passed for human use and repurpose them, that will work as they have worked, for example, in acute COVID-19, will work quite quickly in this area. So that's what we're looking for, but we never can make firm promises, unfortunately.
And Chris, that's given us a nice segue into a bit of a discussion around COVID-19 and long COVID, because one of the successes that we've had within the study is that we've had agreement from the funders to add in an extra 5,000 people who've had a diagnosis with ME/CFS following COVID. So we're calling this our post-COVID ME/CFS arm. And that's really exciting. Can you tell us a little bit about why that is, Chris, just as a reminder to people?
Yeah, absolutely. And also a reminder that this didn't slow us down. This is what we did alongside everything else. So we never planned, of course, to have a post-COVID ME arm. But then the pandemic came along and we realized that there will be people who will be diagnosed with ME because of their COVID infection. And we said to ourselves, well, this might be different, a different type of ME from those who came down with ME prior to the pandemic. And so if we collected everyone together and they are different, then what we'd be actually doing is diluting our power, reducing our power to find something that is relevant to people who've had ME for a very long time. So that was the first thing. And secondly, because we can now separate out people who have been diagnosed because of their COVID-19 infection, we can eventually, once we've got the genetics from both sides, ask how similar or different are they? ME because of COVID-19 or ME because of triggers that were prior to the pandemic? Are they different? Do they overlap or not? And that, I think, is a question that many people want to be answered.
And there's been lots of discussion in the papers and the media and from various doctors and scientists around the potential for us to learn more for post-infectious diseases, including ME, from the money that's going into long COVID research. And so we've had several questions around collaboration with the long COVID research teams and groups and charities. And absolutely, many of us have been linking in with those individual groups with the hope that we can raise the profile and challenge the stigma that exists across different disease areas. And we do want to see that the funding that's gone into long COVID, and absolutely rightly gone into long COVID, that there is equity for ME. And I am going to, I know this is a Decode ME webinar, but I am going to plug the fact, given we've had a question around this, that there is an equity for ME petition that is taking place at the moment. It closes in 2 weeks' time. It's being supported through Forward ME, but you can find out more details on the Action for ME website. And I think that responds to questions around whether or not there'll be more funding provided imminently for ME research. We absolutely hope so, and we will continue to advocate for that to happen. We've got a comment here that says, not a question, but just wanted to say how excited I am that this is happening. And thank you so much for putting so much effort into inclusion. Thank you, Kim, for that comment. Elizabeth has asked a question around long COVID and fitting criteria, and we've just talked about that. But she raises the very valid point that people might not be seeking a diagnosis. And also we know that doctors aren't giving a diagnosis where long COVID has been diagnosed. And will that impact on whether people can take part in the study? You do have to have a diagnosis of ME, whether it's post-COVID or whether you've had it pre-COVID. If you need support getting a diagnosis, then talk to the ME charities, to Action for ME, got an advocacy service, to ME Association and others, to the 25% group. There are many of us that would be willing to support you around that. We've got a question from Alan that says, does ME develop after a person has had a viral condition? I'm just going to maybe, Chris, a quick answer on that one.
There are many studies that show between 70 or 80% of people have said that that they had a viral or bacterial type infection prior to their first symptoms.
Thank you. My wife signed up last year. Will she have to sign up again? She's one of the 25% group and is looking forward to help. We've responded to that question earlier, but by way of reminder, you will get an email, you'll get a link, and that will take you to the questionnaire, which you will need to go through before we determine whether or not you're eligible for this particular study. So we will tell you when recruitment opens and when you can take part. If you've signed up through the website, you will be first in line. So if you haven't signed up through the website, go to decodeme.org.uk so that you can do that. Question from Pauline, will the DNA analysis indicate a treatment plan? Chris, I'm going to come to you on that one.
So it won't. This does not tell why any individual has ME/CFS. What it does say is, as a group, what are the genetics that are different to many other people in the UK? And that's the way that genetics works at this level. And there are other ways that we could look at this and say that individuals have ME symptoms for a particular reason, but that is not what is being done in this study. And why we're doing it in this study and not the other way, it's because this way is powerful and affects many more people, and it's cheaper. And it's the first step, therefore, of many, I hope, along the path of ME genetics.
Thank you. We've had a comment from somebody on Facebook. It's amazing that you're listening to us. We've waited so long to be seen and heard. We've also got a question from Kate. I was diagnosed with chronic fatigue syndrome, not ME. I'm hoping I'm still eligible to participate. Yes, you are. You have to have had a diagnosis. If you haven't had a diagnosis and you think you've got ME, speak to one of the charities that can help support you in gaining access to somebody that can help with a diagnosis. Question from Kate, can you give an idea of who will and won't be eligible for the study? You need to be over 16 in the UK. You have to have a diagnosis for ME. Chris, Sian, anything you want to add? Because there are a couple of other things in terms of eligibility.
So diagnosed with ME or CFS or ME-CFS. And there are some exclusionary criteria that are to do with people's own circumstances. And that's why we have the questionnaire. It will take far too long for me to run through them all, but they match against the Canadian criteria and or the IOM NAM criteria. And that's exactly why we're using those two sets.
Thank you. Sian, anything to add?
Yeah, to repeat, chronic fatigue syndrome, ME, ME-CFS, CFS-ME, any of those names from a clinician that's diagnosed you, and that's what we're looking for.
Thank you. So we've got a question here from Jenny. A number of members of my extended family have or have had ME. Is the data from family groups of interest, including those members of the family who don't have ME? So if people have got the diagnosis, when you go through the questionnaire, we will be asking about symptoms, which will help inform eligibility for this particular study. We are using data from healthy controls, so those that don't have ME, but we're doing that through the UK Biobank, which is the biobank with a whole range of people's data that's held by the University of Edinburgh. Somebody's asked to repeat the website address, www.decodeme.org.uk. We've had lots of positive comments and responses, which we really appreciate. It's lovely to see those. I hope you don't mind. I'm not going to read all of those out. There's a question from Facebook. What exactly are you looking for within the saliva samples?
So the saliva samples have DNA in them. And that means that we can, or at least our partners can extract the DNA, and we will then, through Thermo Fisher, read out the DNA differences that people have. And the DNA differences then will be analyzed to see whether they are more prevalent among people with ME-CFS versus the UK Biobank healthy controls. And that will tell us exactly where in our DNA are the genes that, when changed, contribute to people being more likely to have ME.
Thank you. We've got several questions around comorbidities. So those people with other illnesses, POTS, Sjogren's, fibromyalgia, etc., as well as the diagnosis for ME. Chris, can you just say something around how we're going to be looking at eligibility in terms of other illnesses, diseases?
Yes, so absolutely, people will not be excluded because they have those particular diagnoses. If you have a diagnosis of ME, then you will be eligible for this project with if you've passed the other exclusionary criteria. So I absolutely recognize that people will have multiple diagnoses. But this is a Decode ME-CFS study. And so if you have a diagnosis of ME, ME-CFS, CFS-ME, then by a healthcare professional, then please do participate.
We've got a question from Paul, who says he was diagnosed in 2000, recovered pretty well after about 5 years. As a reasonably recovered sufferer, am I useful to the study? So just a reminder, we have got strict eligibility criteria. You can, if you think that you might still qualify for the study, you can still take part in the questionnaire. And even if you are not taken forward as a participant in this study, you can give consent for your data to be available for other research. Got a question from Facebook. Are the full scientific details of the research design and intended analytical processes going to be released in advance following open science principles? One for you, Chris.
The answer is yes. So, of course, that is the way we do things. The reason why we haven't published our scientific protocol is that we're just busy. I've got it to my right here. I've got it on my list of things to do up on a whiteboard. I just haven't got round to it yet. We will do it as soon as we can, of course. And I know why you're asking this question. We will do everything openly and transparently and to the best of our ability. We will hide nothing.
And we're also going to make sure that people can access the data. So as long as somebody is a bona fide researcher, then we will be following the open source principles. We want to get as much science and research out of the data that we're collecting. We owe it to every single person with ME that happens, and we absolutely will be doing that. We've had a question from Mary who just asked for clarifying what PPI is. It's patient and public involvement, and that's at the very heart of our study. We've got a number of questions that sort of we've already covered. So a question from Gary who says, well, we need a letter from our doctor or consultant confirming diagnosis. No, you won't, but you can find out more information about that from the discussion previously or on our website. Another question from Facebook, will vaccination affect your results? Chris, that's you again.
It will not affect your result. Vaccination does not change your DNA. So it matters not. It's irrelevant to this.
Thank you. And another question from Facebook, how long roughly will this study take? It's a 4-year study. So we will be concluding in 2023.
We have funding until August of 2024.
24. Thank you. I can't do my maths clearly, trying to juggle all the different questions here. We've got some really interesting questions around privacy, data protection, DNA going astray. I'm just wondering, Chris, if you can just give us a bit of a summary answer that assures people about how their details are kept securely and reassuring people about DNA going astray.
So DNA will not go astray. What we are going to do through our partners is batch 5,000 samples together, and in a special process get those delivered to Thermo Fisher all at once in a single batch, and they will process them all at once without ever knowing whose DNA they are. That's the key thing. They will deliver the data to us via an exceptionally secure line from them to us in Edinburgh. These details about how secure it is, what the transfer sharing protocols are exactly the kinds of things we've already dealt with in our contractual arrangements with individuals. The second thing to say is that we hold people's personal data within the University of Edinburgh. Only identified individuals in the project in the University of Edinburgh will have access to them. The exception is that there is a company that will be sending out the saliva sample kits, the spit kits. They need to know what people's addresses and names are. But that under contract is already dealt with. The data will be handled in a secure way and will be destroyed thereafter. So we have covered all of these aspects to the satisfaction of the University of Edinburgh and to the Research Ethics Committee, who have given us the green light now twice for this project.
Thank you, Chris. I just want to say we've had, oh yes, Sian, go on.
Add as well that all of this information will be available in the privacy policy and patient information that has been through so many rounds of patient and public involvement review now. And we've tried to lay it out so that it's really easy to read, really simple to understand what's going to happen with all of your data. And there's going to be multiple consent options so that you can choose exactly how your data is used in the future.
Thank you, Sian. We've got a number of questions I'm afraid that we can't answer around why does it take so long for diagnosis, and particular questions about people's personal circumstances. So I do apologise that we're not able to answer those. If you need support or have questions, please do go to one of the ME charities if it's about something personal and not Decode ME related. I've got a question here about age cutoff for selection for the SPIT kit. I'm almost 75 and have had ME for around 43 years, diagnosed around 10 years after onset. Quick answer, Chris, I can see already and know the answer, but you go for it.
There's no upper age limit whatsoever. And if you're just under the 16-year-old lower age limit, wait a bit until you're 16 and then please register.
Thank you. I'm just going through, sorry, we've got a huge number of questions here. I'm trying to make sure that we get a broad enough kind of cover with these. How can we trust that the outcome will be fair, honest, and not manipulated as in the GET trials? Chris?
No, it's a really good question. The only way is to be honest and transparent as to exactly what we are intending to do throughout the whole project. What are the analyses that we're going to do? And to hold ourselves to the higher standards, international standards, so that if we find nothing, we say that we've found nothing. Doesn't mean that ME would not be genetic. It would just mean that in this study, there would just be insufficient numbers of people to find the genetic basis to ME. But if there is a null result, we'll say so.
Thank you. So we've had a question about asking for reassurance that private medicine has no involvement in Decode ME. I can absolutely say that that's the case. We've had a few questions around which other countries involved. This is a UK study only. You have to be living and have an address and be based in the UK. We are looking at how we can replicate this study. We have no money to do that. We have identified potential partners that we want to speak to, but our focus at the moment is getting the recruitment launched for this study. We are committed to exploring how to make sure that we can grow the number of participants, but we haven't had a chance to really develop the work on that at the moment. Chris?
There may be some confusion that we're partnering with Solve, which is a US-based charity. And the reason we're doing that is that in the future, the same type of studies will be done across the world, at least I hope. And they have infrastructure that should be reused again and again and again. That's why we're partnering with them. It isn't to say that we are expecting people in the US to participate. No, this is a UK-based project.
And I'm very conscious that time is running out. So question for you, Chris, from Kim. What is being done to ensure research isn't duplicated to work already being done by the OMF in the US and others?
Well, I keep a close eye on what OMF are sending me through email and on their websites, and I haven't seen a study of this type or size being funded by them. And that's a good thing, right? I mean, doing different types of research means that hopefully a breakthrough will be made by someone soon. Now, if there were to be a study somewhere doing something like this, we would work alongside them and with them, because we're all in this for one reason, and that is to find the way forward to ensure that people with ME have, as soon as possible, new therapy that works.
Thank you, Chris. I'm really sorry we've run out of time to be able to answer any more questions. Several of the questions that I'm just scrolling through at the moment are, you can find answers on the website www.decodeme.org.uk. So please do have a look there. We're not able to answer lots of questions on social media and through the website at the moment because all our effort is going on getting ready for the launch in January. So please please bear with us if you just get a holding email, or we say we will review the frequently asked questions as and when we can. We really are trying hard to be as responsive, whilst also making sure that we do deliver everything that we need to, so that we can hopefully launch the phase 1 of the study in January. So I just found a really lovely comment from somebody to finish on, and because so many more questions have come through, I now can't find it. So I will probably do that in a moment once we've finished. But I just want to say thank you to all of my Decode ME colleagues. At the beginning of the webinar, we showed an image on the screen, and even as we've gone through, I've realised we've probably missed a couple of people off. I want to thank every single person watching for all your questions, your engagement, your words of encouragement, for people on social media that have sent positive comments in as well as questions. And we will continue to work with you, to engage with you, and to ensure effective involvement in every single aspect of the study. This study has people with ME at the heart of it, but that runs through every single aspect, decision, piece of work that we do. And if you joined us at the end of the study, this webinar, at the end of the webinar, a recording will be available so that you can access this afterwards. You can watch it in bite-sized chunks if you need to. You can watch it with the screen off as a podcast. You can share it, and you can listen to some of the ways in which patient and public involvement has changed this study for the better. And this study is about people with ME. It's your study, it's our study, and we hope that you will continue to support us. And we hope we blow that 20,000 target very, very quickly after recruitment launch, and the additional 5,000 of people who have had a diagnosis post-COVID. Thank you very much, everybody.